Did you know that in the United States, 1 in 5 adults and 1 in 6 youth between the ages of 6 and 17 experience mental health disorders each year? If you're struggling with your mental health, you are not alone, and it is an important topic to discuss with your medical provider. However, what may not be obvious to you or your healthcare provider is how your sleep may be playing a role in how you feel. Believe it or not, sleep can have a huge impact on your mental health, and your mental health can have a huge impact on your sleep. Research shows that the presence of problematic sleep can increase the likelihood up to 2 to 6-fold of later development of a mental health disorder, like anxiety or depression, when compared to age-matched peers without problematic sleep. In addition, sleep issues remain common after diagnosis, with about 75% of individuals with depression experiencing symptoms of insomnia or hypersomnia. Unfortunately, sleep comorbidity can come with very serious consequences. In fact, studies have suggested that the presence of insomnia is associated with almost a doubling of risk for suicide. Nightmare frequency and intensity positively correlates with suicide risk, and sleep apnea is also associated with increased risk for suicide and self-harm behaviors. There are multiple theories that have been suggested to explain this connection, with the most common themes being decreased inhibition, impaired decision-making, abnormal reward processing experience, and emotional dysregulation being coupled with increased impulsivity, social isolation, and an intensification of negative mood and feelings. Even before discussing sleep strategies and considerations, it's important to know that there are resources out there for everyone in need. If you're experiencing any of these symptoms or thoughts discussed today, please know that there are local resources for you, such as the 988 Suicide and Crisis Lifeline. Dial or text 988 if you or someone you know is having thoughts of suicide or experiencing a mental health crisis for 24/7 support. The crisis text line, text HOME to 741-741 to connect with a trained crisis counselor for free, 24/7 support. And finally, the National Domestic Violence Hotline. Call 1-800-799-SAFE to receive confidential support to anyone experiencing domestic violence. Sleep is your body's time to recover, rebuild, and recuperate. When we do not get the quality, timing, or duration of sleep our body needs, we deprive ourselves of the opportunity to rebound from the stress of the day, resulting in a dysregulated fight or flight response. When we incorporate the optimization of sleep into a holistic treatment paradigm to optimize mental wellness, we not only take a 24-hour approach, but also increase our odds of better outcomes. In fact, a recent meta-analysis that evaluated 65 trials, including 72 interventions and more than 8,500 participants, demonstrated a dose-response relationship between sleep and mental health improvements. What does that mean? The greater the improvement in sleep, the greater improvement we saw in mental health. The call to action based on this research was identifying better ways to incorporate sleep into mental health treatment and practices. Good thing we're here having this conversation today and taking these steps together to achieve better nights for brighter days. Are racing thoughts keeping you from a restorative night's sleep? Well, of course, we're always going to encourage a regular bedtime routine and ways to wind down, such as relaxation techniques. Here's a few to try. Breathing exercises are considered a great strategy to consider and can be done at any point in the day and for whatever length you need. Ideally, start your time with just 2 minutes a day and increase to 5 when you feel comfortable. These same strategies can be used as part of your routine for bed in response to those racing thoughts. Practice multiple times a day. This will help it become more natural and less stressful to engage in at night. Practice will not only help you set a schedule, but also help you become consciously aware of your patterns. Let's review some examples of breathing exercises you can try. First, pursed lip breathing. Relax your neck and shoulders. Keep your mouth closed. Inhale slowly through your nose for 2 counts. Pucker or purse your lips as though you were going to whistle. Exhale slowly by blowing air through your pursed lips for a count of 4. Next, you could try diaphragmatic breathing. Lie on your back with your knees lightly bent and your head on a pillow. You may need to place a pillow under your knees for support as well. Place one hand on your upper chest and one hand below your rib cage, allowing for you to feel the movement of your diaphragm. Slowly inhale through your nose, feeling your stomach pressing into your hand. Keep your other hand as still as possible. Exhale using the pursed lips as you tighten your abdominal muscles, keeping your upper hand completely still. Finally, you can also try equal breathing. Choose a comfortable seated position. Breathe in and out through your nose. Count during each inhale and exhale and make sure they are equal in duration. Alternatively, choose a word or short phrase to repeat during each inhale and exhale. You can add a slight pause for breath retention after each inhale and exhale if you feel comfortable. Continue practicing this breath for at least 5 minutes. Hopefully these tips help you get to sleep a little bit more easier.